Now, if my average is 2100 kilocalories per day, that is what will dictate the quantity of water I need to consume. Now, if, for example, I need 21 kilocalories, for each kilocalories that I consume, I need a milliliter of water to break it down. Now, in that circumstance, you just convert the 2100 kilocalories to quantify the water. A few things we need to be very conscious about. When we do general discussion and general counseling, you start telling somebody that you need 2 liters of water. I tell people that nutrients are good for the body, but excess of everything, we eat what is bad. So even excess of water is bad.
Yes, I even tell people that even vegetables and the fruits that we actually advocate that you consume them, if you overconsume them, it's also bad. And as you've heard my colleague saying, if you overdrink the water, it can be detrimental. So, Odero, what is the situation that will make someone be said to be overdrinking water?
When you take too much water, there are very prominent signs will come out.
Like
one of them is a overhydration, which can affect general body functionality. Other than that, there is frequent urination, which is an indication that the quantity of water you are taking is not functioning in your body, but actually it is being passed out. Now, what comes as effects of too much urination? When you urinate too much, you also tend to pass some micronutrients through your urine. And most specifically the electrolyte. So if you overdo the water, you can also be doing injustice to your system.
But again, I understand that as a dietitian, I also know that maybe someone might be needing so much water, maybe they are over engaging in other activities, maybe their metabolic rate is higher. As you said, your caloric intake will definitely determine the amount of water, and definitely your BMRs, and also your activities, what you're doing during the day will determine the amount of water that you actually need. So all these are factors that you need to consider when you're taking up water intake a day.
I would want to comment about the activity facts. There is this notion that people who do a lot of exercise should take a lot of water, which is correct, because they lose a lot through sweat. But again, there's caution on how you take it. You'll see our athletes, when they go around running, they don't carry the normal mineral water. So it means
electrolyte solution.
As you lose water, you also lose with other things. So just taking more will lead to you losing more. So you need to be cautious on how you take it and what is the composition on how you take it.
That is exactly what I usually tell you guys. It's what you're eating and how, like, the combination of anything. The same applies to water. So when you're taking up your fluids, as you have said, make sure that you combine them. If you're losing too much water, if you're drinking too much water, you make sure that you take care of your electrolyte needs. That is what you have emphasized. Now, another thing, on disease management. You know, water needs are affected by someone who has diabetes, someone who has hypertension. This is another thing that actually affects water needs. Someone who has metabolic disorders like maybe obesity or insulin resistance, their water needs tend to be higher, or in other conditions like hypertension, their water needs need to be lower. So when someone is trying to mediate this, what are some of the things that they should do first? Because when you see someone who has a chronic disorder, they usually take a lot of caution in what the dietitian says. So when you tell someone that I need you to take this amount of water, some of the cautions, you can give us an example of a disease or a condition that someone will tell us that they have this condition and we need them to reduce or increase their water intake regardless of their caloric needs or regardless of their activity levels.
We'll start from a normal person. When does a normal person need excess water of their normal requirement? We have given a good example of during the exercise period, you lose a lot and you want to take caution of the electrolyte. Now, in the process, you must know exact quantity you are taking and what electrolytes you are losing and what are you replacing. Now, that is the normal circumstances where I will say my daily energy caloric breakdown is 2100, but I will have to go excess because I'm also trying to look at the situation where I should not go dehydration and all that. Now, disease management also starts with how best the disease condition is managed. Now, that influences the prognosis of the disease. Now, the prognosis of disease also influences the quantity of water. Because each and every nutrient as long as the state of health is not in normal state, that is, somebody is not healthy, everything is altered. And a good example is, I want to talk about diabetes, for instance, and for diabetic patients, the better they are managed, the better they can live.
Yeah, true.
Now,
true.
if they are managed better and they do their maybe oral reducing agents or insulin well, then the water will not be a worry, as long as diet is well done.
It's well done.
Now, if it comes to a situation where now we have to worry about water, it simply we have to treat the cause of that worry. And in such circumstances, it means we are not managing the condition well.
Yeah.
Those are facts. I want to look at on flip side a situation where we need us not to do a lot of water. For example, hypertension. Now, hypertension comes as a result of the body activity pumping of the heart. And when the heart pumps, what it does is to circulate blood.
Yeah.
The higher the volume of blood, the higher the rate of pumping.
Yes.
The lower the volume of blood, the lower the rate of pumping.
Yeah.
When that happens, a large quantity of water we consume, apart from helping upgrade the calories, other components are used into our blood to enhance the blood volume. Actually, a high percentage of blood is water.
Yeah.
Now, the higher the amount of that water in the blood, the higher the pumping will be. And that can be very dangerous for hypertensive patients. Yes.
That's a very good classical example. As you have heard, water is important. Being well hydrated is very, very important. And there are conditions, as he has talked about, that will affect your water needs. One of them is activity level. The second one is basically your caloric needs, how much you need per day. The third one is disease. Do you have any underlying medical condition? And the fourth one that I would want to emphasize is the climate. Now you see, like on this video, we are at Mombasa. We are at Serena. The venue is very beautiful, by the way. Serena, you guys are doing a good job. And you can actually tell from my needs, my water needs, for this day, for this period that I'm going to be in Mombasa, definitely going to be higher than when I'm back in Nairobi, because the environment, the climate is affecting that. But again, as we have talked about, when you're increasing your water needs, you need to make sure that you take care of your other small micronutrients. If you are diabetic, you make sure that your blood sugar is well controlled so that you don't go hypo. You can also lose a lot of water when you're diabetic, and with uncontrolled blood sugars. Another thing is also take care of your electrolyte needs. When you're taking care of your water needs, you need to make sure that you do that, because small things like potassium, sodium, they take care of how your heart is pumping, they take care of how your muscles are contracting, they take care of how your nerves are functioning. So these are things that when you affect their balance, you're going to affect your general health, and they can be detrimental. I usually say these are small components that are needed in small amounts, but they can be very detrimental if affected with. And this is one of the things that is affected with overconsumption or over drinking of water. What am I trying to say? Drink enough water. Do not get yourself dehydrated. Before we stop, maybe we can touch on the dangers of dehydration. Dehydration is basically not consuming enough water.
Dehydration is one of the most complicated cases to manage.
Yeah.
Because it simply means your cells have lost the required quantity of water for them to survive.
Yeah.
And you remember, dehydration in itself has stages that beyond which it goes to a shock.
Yeah.
And when you are at shock, you can't walk, you can't talk, you are headed to death.
Yeah.
So dehydration is one thing that can influence your life negatively and suddenly.
Yeah.
You need to take care of it.
Yeah.
And dehydration can happen very easily.
Very
Easily. Like you said, we are in an environment where there is heat in Mombasa. The temperatures are high. We are losing a lot of water through sweat, and it is scientific that when you are in an environment where there's a lot of heat, your body functions fast, metabolism is fast, and when the metabolism is fast, it means your body wants to lose waste, and that's where we also release water through waste.
Yeah.
Now, in that circumstance, you can lose water to a level that you realize you are going down. But before you reach the level of dehydration, your system is conducted in a manner that it will always tell you.
Yeah.
Thirst is so long before dehydration.
Yeah.
You will feel thirst actually several miles away from being dehydrated.
Yeah.
So always take the question of, before you reach that level, can I do something? And when you are dehydrated, you will automatically have electrolytes imbalances.
Yeah.
You will automatically have malnutrition because your system cannot break down food. And two easy things that can kill you easier than any other thing is electrolyte imbalance and malnutrition.
And another thing to add on dehydration, our main aim in life is to live longer, but making sure that we live younger. If you are dehydrated, the easiest way to age faster is be dehydrated, because your cells lose the turgidity, so your skin starts shrinking. You start getting premature wrinkles, premature aging, and all these are things that you want to avoid. So tell me in the comment section down below if you should be doing this more. That was it from us. Thank you so much for joining us. Thank you so much for for honoring us with your presence. We appreciate you guys, and make sure that you like this video, subscribe, hit the notification bell. We'll see you on the next one. Bye.